Knock knock. My name is Tisha. I'm going to be your nurse today. I'm also going to be doing a postpartum assessment on you, just to make sure everything's okay with you and the baby. Can I get your name and date of birth? Perfect. Okay. So, are you having any pain right now? No? Wonderful. And your vital signs that look great. It looks like we have a 120/65 blood pressure, 64 pulse, and 98 oxygen rate, and a temperature of 97.6. So everything looks good. And I checked the environment. The environment is good. There's nothing for you to stumble over if you decide to get out of bed. So that's good. I do have to put my hands on you. I'm going to be wearing gloves, putting them on. But I will need to assess your breast area, your uterus area, and your lower extremities, and just a general overall view. So if you don't mind me putting my hands on you, if you feel uncomfortable or you have pain in any other area, I know you said you're a 3 out of 10 now, which is okay. But if it gets anything worse than a 4 out of 10, let me know during the assessment. Okay, so we're gonna first expose your breasts and just take a quick look at those if you don't mind. And I can see that they're symmetrical. You have the everted nipples. There is a feeling of fullness. I can tell that the glands are slightly swollen. I don't see any of that colostrum or whatever yet, but it looks like you're on your way. I don't see anything abnormal there, so I'll go ahead and cover you back up. Next, I do have to look at your uterus, so I am gonna pull your gown up and expose your uterus area. So the measurement of the top of the uterus is at the umbilicus, which is good. And my hand is gonna anchor down your uterus while I do some firm but gentle, deep massaging. It might be a little bit uncomfortable, but it is necessary. So we'll just have you take a deep breath and slowly blow out. And I am massaging, and while I'm massaging, I'm checking to make sure that the drainage or lochia coming out is appropriate, which you do have a little bit of blood, but no clots that are bigger than a quarter size, and it's just a minimal amount. So I think we're good there. I don't notice any odor. There's no weird drainage going on besides the bleeding, which is normal. This is your first pad that you put on, so I know that it's been over an hour. So if you do happen to bleed through a pad, and you notice that it's happening every hour, you will want to notify your doctor right away. If she had a C-section at that time, I would look at the dressing. If it's been less than 24 hours, obviously we're not removing it, but there's no strike through, there's no erythema around the area. I don't see any drainage coming out. It looks nice, clean, and intact. So next, we're going to have to turn you over. I just need to see if you have anything that we need to monitor after the baby was born. So if you don't mind, I'm going to have you turn to your right. Okay, are you okay? Awesome. So I do have a good view here. There is no episiotomy. It doesn't look like you tore either, and I do not see any hemorrhoids, so all of that is good. They did a really good job delivering your baby. I'm gonna go ahead and assist you back on your back. Okay, wonderful. So overall, your skin looks good. No diaphoresis, warm, normal color. Cap refill is less than 3, so the skin is looking good. Lastly, I'm gonna expose your lower legs. We're just checking to make sure that the circulation is good and there's no clots. So I'm gonna say, if you are having any pain behind the knee or in the calf area, no? No? Wonderful. So pedal pulses, everything checks out there. So it looks like you're getting good good blood flow, and I don't see any signs of any blood clots, so I'm gonna go ahead and cover you up. I notice you, your husband, and your baby are getting along fine. Do you have any concerns that you wanted to ask me about? Okay. I do need to do a little bit of education before you leave. If you're having any shortness of breath, any chest pain, any seizure activity, obviously, you know, need to head to the ER right away. Maybe you have a headache that doesn't go away without Tylenol. And obviously we did talk about the bleeding, but you do want to make sure that, I know you said you like to exercise, so if you decide to resume exercise, it's going to have to be not at what you were doing before. You're going to have to really monitor for the bleeding, because if you start exercising, you're going to bleed more. So just be really careful with that. And you do need to have the perineal rest, so you and your husband need to avoid any sexual activity for the next 6 weeks. I think that is good. I'm going to leave you in the hands of the CNA, and I will note in the chart that I did check her bowel tones and that she had a bowel movement in the last 24 hours and that they were positive. Also, her Foley cath is intact with clear amber urine, and it looks to be that it's draining more than 30 cc's an hour. So I will just put that note in her chart as well.
Okay, thank you.
All right. Okay.